If you take your blood pressure medicine first thing in the morning without thinking about timing, stay with me. If you take your water pill later in the day because mornings are too busy, this is for you. And if you have ever missed a dose and thought, I'll just make up for it tonight, I need you to hear every word of this. What I'm about to explain is something millions of adults over 60 are never clearly told when that prescription is handed to them. Not whether to take the medicine, not whether blood pressure treatment matters. It absolutely does. What often gets missed is this: when you take it, what you take it with, and what time of day can quietly turn a helpful medication into a dangerous mistake. And there is one timing error I see over and over again in older adults that can increase dizziness, disrupt sleep, reduce protection during the most vulnerable hours of the day, and in some cases, create a real risk of falling, fainting, or ending up in the emergency room. If you are over 60 and on blood pressure medicine, or you help someone who is, stay with me, because mistake number 3 is the one that surprises people the most. I'm Dr. Clara Hoffman. I created this channel because too much of the information that protects patients never makes it into a short office visit. People are told what to take. They are told the dose. But they are often not told the most important part after that, the timing. And timing matters. Today, I'm going to walk you through the 5 most dangerous blood pressure medication timing mistakes I want every older adult to know. These are the mistakes that can weaken treatment, raise risk, and leave your heart, brain, and kidneys less protected than you think they are. And before we finish, I'll give you the exact questions to bring to your doctor or pharmacist before your next dose. Let's start with the first mistake. The first dangerous mistake is assuming that morning is automatically the safest time for every blood pressure medication. For years, many patients were told the same thing: take it in the morning. It became routine. Easy to remember, easy to print on a label. But routine is not the same thing as individualized medicine. Blood pressure is not flat all day long. It follows a rhythm. In many people, it rises sharply in the early morning hours, and that is exactly when the risk of heart attack and stroke is higher. That early morning surge is real. And for some patients, especially those on certain once-daily medications like ACE inhibitors or ARBs, bedtime dosing may provide better coverage during that vulnerable window. Drugs like lisinopril, ramipril, losartan, and valsartan are often prescribed once daily. But the safest and most effective time is not identical for every patient. Here is the problem. Some adults over 60 take their medication in the morning because that is how they started years ago, even though their blood pressure may be highest before sunrise. Others switch themselves to bedtime because they heard it online, without realizing that nighttime dosing can be a bad idea if they already have dizziness, low overnight pressure, balance problems, or frequent nighttime bathroom trips. So the dangerous part is not simply morning or bedtime. The dangerous part is taking it at a time that does not match your body, your medication, and your risk pattern. That is why one of the most important questions you can ask is this: should this specific blood pressure medication be taken in the morning, or would bedtime be better for me? Not for the average patient, for you. Now, the second mistake, and this one causes problems constantly: taking a diuretic too late in the day. If you are on a water pill, timing is not a small detail. It is everything. Diuretics like hydrochlorothiazide, chlorthalidone, and furosemide lower blood pressure by helping your body get rid of excess salt and fluid. They work. They are useful, but they also do exactly what their name suggests. They make you urinate more. And yet, many older adults take them at the wrong time. They forget the morning dose and take it at 4 p.m. They sleep late and take it after lunch. Or no one ever told them the rule in the first place. Then night comes. Now they are getting out of bed again and again, half awake, lights off, blood pressure shifting when they stand, possibly a little dehydrated, possibly already unsteady. That is not just inconvenient. That is dangerous. Because after 60, one nighttime fall can change everything. The right timing for most once-daily diuretics is early in the day, usually in the morning. If it is prescribed twice daily, the second dose is often taken in the early afternoon, not in the evening. Late dosing turns a blood pressure treatment into a sleep problem and, in some patients, a fall risk. If your water pill is making you get up multiple times at night, do not just accept that as normal aging. Ask whether the timing is wrong. Now, mistake number 3. This is the one that catches people off guard because it feels harmless. Taking your blood pressure medicine with coffee. I see this all the time. A patient wakes up, takes the pill, takes a sip of coffee, and keeps moving. It feels efficient. It feels normal. But depending on the medication, that timing may be working against you. Caffeine stimulates the nervous system. It can temporarily raise blood pressure, increase heart rate, and make palpitations more noticeable in sensitive people. That matters most when the medication you are taking is supposed to calm that same system down. Think about beta blockers like metoprolol, atenolol, propranolol, or carvedilol. These medications reduce the effect of stress hormones on the heart. They slow things down. They reduce workload. They are often used in people who already have blood pressure issues, rhythm problems, or heart disease. Now imagine taking that medication and then immediately flooding your system with a stimulant. For some people, nothing dramatic happens. For others, especially older adults with arrhythmia history, tremor, anxiety sensitivity, or a heart that is easily provoked, that combination can create a very uncomfortable and sometimes clinically important window. Palpitations, jitteriness, feeling the medicine is not working. False reassurance or false panic based on a blood pressure reading taken right after caffeine, and this is the part many people miss. Sometimes they are not just timing the medicine with coffee, they are timing their blood pressure check with coffee too. So now the reading is distorted, the medication gets blamed, and the treatment plan starts drifting based on bad information. If you take a beta blocker, or if caffeine seems to affect you strongly, it is worth asking whether you should separate your medication from coffee by at least a short interval. A simple habit can matter more than people think. Now, mistake number 4, and this one is not about the clock on the wall. It is about the timing between your medicine and something in your kitchen. Grapefruit. If you take certain blood pressure medications and still eat grapefruit or drink grapefruit juice, this is a conversation you need to have with your pharmacist. Grapefruit can interfere with the way some drugs are broken down in the body. And with certain calcium channel blockers, that can raise medication levels higher than intended. Drugs like amlodipine, nifedipine, and felodipine are common examples people recognize. Not every interaction is dramatic. Not every patient reacts the same way. But the important point is this. Grapefruit is not a harmless side note if your medication happens to be one of the affected ones. Higher drug levels can mean stronger blood pressure lowering than expected, more dizziness, more lightheadedness, a greater chance of feeling weak or unsteady. And the reason this becomes a timing problem is that grapefruit's effect is not always limited to the exact minute you consume it. The interaction can last beyond one meal. So a patient may think, I had grapefruit last night, my pill is this morning, that should be fine. Not always. If you are on a calcium channel blocker, ask directly, is grapefruit a problem with this specific medicine? Do not guess. Do not assume. Ask. Now the 5th mistake. And this may be the most dangerous one of all because people do it when they are trying to be responsible. Doubling up after missing a dose. This happens constantly. Someone forgets their morning pill. They remember at dinner. They panic a little. And they think, I'll just take 2 now so I don't fall behind. That is not a harmless correction. With some medications, a late dose may be acceptable. With others, the safest move is to skip and wait for the next scheduled dose. And with some, doubling up can drop blood pressure too fast, too far, and at exactly the wrong time. That can mean dizziness when standing, blurred vision, weakness, fainting, falls. And older adults do not need a dramatic overdose for this to become a serious problem. They just need one bad timing decision at the end of a tiring day. There is a second version of this mistake that is just as dangerous. A patient misses doses often, starts moving pills around to balance things out, and ends up taking medication at inconsistent times every day. Now the blood pressure is no longer being controlled in a steady way. Protection becomes uneven. Readings become confusing, and nobody knows whether the medication is failing or the schedule is failing. If you miss a dose, the answer should come from the instructions for that exact medication or from your pharmacist or doctor. The answer is not automatically take two. In fact, that is often the one thing you should not do. Before we finish, I want to be very clear. Blood pressure medication saves lives. This is not an argument against treatment. This is not a message to stop your medication. And this is not me telling you that your prescription is wrong. What I am telling you is that many adults over 60 are taking the right medicine in the wrong way. And when that happens, the consequences can be quiet at first. A little dizziness, a few nighttime bathroom trips, an afternoon blood pressure spike, a strange feeling after coffee, an extra pill taken out of fear. Then one day it is not a small issue anymore. That is why this conversation matters. If you are over 60 and taking blood pressure medicine, here are the 5 questions I want you to bring to your next appointment. Should I take this medication in the morning or at bedtime based on my blood pressure pattern? Is this medicine safe to take with coffee, supplements, or my usual breakfast? If I miss a dose, exactly what should I do for this specific prescription? If I am taking a diuretic, what is the latest safe time of day to take it? Are there foods or drinks, including grapefruit, that can interfere with this medication? Those 5 questions can prevent mistakes that no label fully explains. If this gave you information you did not get at the pharmacy counter or in your last appointment, share it with someone who takes blood pressure medicine and may be making one of these timing mistakes without realizing it. And if you want more clear, practical medical guidance explained in plain language, subscribe now because this is exactly what I cover here. I'm Dr. Clara Hoffman, and this channel exists to bring the conversation home that should have happened in the exam room. I'm Dr. Clara Hoffman, and I'll see you in the next one.